New at 10, the Idaho Department of Correction is looking to pay for services that may help nonviolent criminal offenders with mental health and substance use disorders avoid jail time. IDOC's pre-prosecution diversion grant program is focusing on treatment, rehabilitation, and victim restoration instead of prosecution. News Channel 7's Tristan Lewis joins us now with more insight on how this program is working and how it was formed. Tristan.
Yeah, so the Idaho Behavioral Health Council actually put together a strategic plan. It included a list of proposals for increased behavioral health resources for the state. Idaho Governor Brad Little approved those recommendations with his Leading Idaho plan back in April. And part of the proposal is to help support and fund recovery centers for people with substance use or behavioral health disorders.
How do we get those folks help?
Idaho is trying to fill in the gaps when it comes to mental health in the Gem State.
And where can we create off-ramps for people who might have mental illness or substance use disorder needs that they're not able to resolve or address on their own?
Leaders with the Idaho Department of Correction hope to create off-ramps through their new program, the Pre-Prosecution Diversion Grant.
Can we get them treatment before they get involved with the criminal justice system?
The department is offering $2.5 million worth of funding to state and local government agencies. The money will help those accused of nonviolent crimes avoid prosecution by addressing mental health and substance use disorders.
We see it a lot, where we see people coming through our front door where you really look at their case and you see missed opportunities to try to put them on a different path.
CEO of Recovery United, Monica Forbes, says this grant seems to be a step in the right direction.
We're seeing a lot more effort towards providing those support services.
Recovery United helps operate multiple recovery programs throughout Idaho to help fill needs and gaps around communities.
Historically, it seems like in our community, the drugs are a lot more available than the behavioral health services are.
To address behavioral health in the state, Forbes says preventative and community-based services need support and funding, especially when it comes to keeping nonviolent offenders out of Idaho's prisons.
We also know that 29% of the prison population in 2018 qualified with a serious and persistent mental illness. A lot of those people reported that they were either untreated or undertreated prior to their engagement with criminal justice. If we can provide those services prior to or as an alternative to going to prison, where we're just going to actually be exacerbating the problems and creating new situations and challenges that are going to exist with that, it makes sense to try and do some preventative things.
And as someone who was in the prison system herself 15 years ago, Forbes knows the challenges people face once they leave.
Take something where it's already, you're having challenges functioning on your day-to-day life, and let's add in there the fact that you now are going to feel like you have felon or criminal tattooed across your forehead, and essentially you might as well.
She is glad to see positive changes within systems in Idaho.
Now they're starting to prepare them. They're allowing them to go out in the community and work. They're normalizing things.
And hopes to see it continue.
We've done a lot. I think we can do more.
And again, the money for this grant would go towards government agencies like local police departments or county prosecutors' offices. And their purpose is to help teach new models or programs to help give people in need those treatments. And the Idaho Behavioral Council will help review some of these grant applications, and they'll decide who receives them.
And have they started giving out any money yet?
So it started last month, and it will go towards the end of next June. And we do have a link on our website to fill out that grant application.
This is a full year program.
Yes.
All right, Tristan, thank you very much.